call it.
Yeah,
So
great.
we're all set.
I will do a roll call. Commissioner Guillermo,
Here.
Commissioner Chow,
Present.
and Commissioner Green.
Present.
Okay. Good afternoon, folks. Good to see you all.
Good afternoon.
Looks like we have the approval of the minutes from our last meeting last month on the next item. If I can have a motion to approve.
So moved.
Second.
And I will note there's no one on the public comment line, so there's no need to check. And I will do a roll call vote. Commissioner Chow,
Yes.
Commissioner Green,
Yes.
Commissioner Guillermo.
Yes.
All right, the item passes. Thank you.
Okay. And general public comment, Mark, as you said, there's nobody on the line.
Correct. There's no one on the line, so there's no general public comment.
Okay, great. So let's move right on to the executive team report. Michael?
Good afternoon, commissioners and Mark. And our apologies for a slight delay. We were having some AV difficulties, but I think we've got them under control. So I hope everyone is doing well. Generally, we had a very exciting month of May, and things are progressing very well here at Laguna Honda. So we are very excited to tell you about what some of our updates look like. So if you can go ahead and load for me, Zoe.
Mark can give us control.
Okay.
I apologize. I just gave that to you. Permission.
All right. Thanks, Zoe. So Zoe, could you please advance to slide 4? There we go. All right. So just a quick COVID update. So here's our case detail. As of May 31st, overall, we've had 237 positive cases. Currently, there are no active cases. And more importantly, we've had 0 positive cases since the month of January. So we're very, very pleased about that. Next slide. Here's a breakout of our total cases for 2020 and our monthly case count thus far in 2021. As you can see, we've had a significant drop-off in cases starting in the month of February, which coincided with our vaccine campaign. All of our staff cases since January have been among unvaccinated staff. And we had just 1 positive staff case during the month of May. And here again, that was with an unvaccinated staff member. And actually, there's a typo there. It should be 237 total cases. Next slide. So as I mentioned, we're very pleased with our vaccine rollout. Fully 85% of our staff have been fully vaccinated. Of course, although we're at 85%, we're continuing to shoot for 100%. But when we look at the fact that we have only 215 unvaccinated staff out of 1,739 total employees, that's obviously a very successful vaccine campaign. We vaccinated an additional 14 staff members in May, so we expect that 215 number to continue to decrease in the coming months. Next slide. For resident vaccinations, we're at 90% fully vaccinated. And that's just an amazing number. Every time I see it, I'm just so thrilled at the fact that we were able to vaccinate the vast majority of our residents. And obviously, this is clearly reflected in the fact that we've had no positive resident cases since January. Next slide. So on to a quick quality update. So we recently hired our new infection control nurse, Dr. Keith Howard. Dr. Howard is a seasoned infection control practitioner with a doctorate in nursing practice. He's also board certified in executive nursing leadership and infection control with the American Nursing Credentialing Center. And Dr. Howard came on board on May 17th. So we're very, very pleased to have him on board. We also, thanks Zoe. We also want to thank Jennifer Yu for her tremendous support in this role throughout the pandemic. Jennifer was really instrumental in helping us to develop our protocols and also in helping us to minimize our overall positive cases. We'd also like to congratulate Jennifer. She recently received a promotion and she will be working in the Department of Education. So we wish her the very best in her new capacity. Slide. So for our care experience, one of the best aspects of returning to normal here at Laguna Honda is the fact that we have an opportunity to safely reopen our services. This year has been a tremendous strain on our residents in so many ways, and so it's very rewarding to be able to reestablish a lot of the services that we've had offline for such a long period of time. We are working very closely with our health officer as well as our city attorney to finalize a health order that will include the latest guidance from CDC as well as state and other authorized sources. In addition to reestablishing our services, such as our resident Out on Pass program, we're also continuing to expand our visitation. And one of our goals really is to revert to a pre-pandemic visitation model as soon as possible. Clearly, we're still a ways from that, but with each passing week, we inch a little bit closer toward getting back to a pre-pandemic model. And later this month, we are going to be reopening the chapel for resident services. So that's something that we're really looking forward to. Next slide. So here's a snapshot of our monthly admissions, discharges, and expirations. And this is for the period May 2020 through May 2021. During this period, we averaged 11 admissions per month, and we had a total of 25 admissions during the month of May. And we obviously anticipate a continuing uptick in admissions as well as discharges going forward as we continue returning to normal operations. And also during this period, we averaged about 7.6 expirations per month, and we had 5 expirations during the month of May. Next slide. So for a quick financial update, this is a summary of our Q3 financials. Essentially, this is the same summary from our last month's presentation because we essentially didn't have any changes to our June projections. So the numbers are essentially the same for this update. Overall, we have a surplus in both revenue and expenditures for Q3. And our finance team is continuing their process of year-end reconciliation. And so we should have a clearer picture of our overall budget later next month. And at that point, we should be able to give you a better idea of what that reconciliation looks like. Next slide. On the revenue side, we have a $12.56 million favorable variance in our Medi-Cal revenue, as you can see there. And this favorable variance is due to a higher than expected SNF per diem rate. And so our SNF per diem rate is tied to the public health emergency that was declared during the pandemic. When that public health emergency was declared, later we were granted an increase in our SNP revenue. So that's one of the reasons that's driving it. The other reason is that the federal government, we received a 6.2% increase in the federal government's share of our Medi-Cal revenue. So, and that was also linked to the pandemic as well. So those were two primary drivers for that surplus in revenue. On the Medicare side, Medicare revenue side, we have a $2.26 million unfavorable variance, and that was due to we had an increase in pharmacy expenses, and we also had a lower than expected outpatient visits. And so as a result, overall, we had a total operating revenue of $8.85 million, and that was a positive variance there. Next slide. For expenses, we show a combined $8.37 million positive variance in salary and fringe benefits. And so this surplus was the result of an authorization that we received from DPH to move certain labor expenses from our operating budget to a DPH COVID fund. And also on the non-personnel services side, we had a $300,000 negative variance, which was due to higher than expected registry services. And we also had a $2.08 million surplus in materials and supplies that was linked to COVID for cost recovery. And that gives us a total of $10.15 million positive variance overall in total operating revenue. Next slide. So for the month of May, our team of the month was our quality management team. This is a really very well-deserved award for a very humble and hardworking department that is led by our Chief Quality Officer, Naz Talat. A great job, Naz. You know, I think we all can appreciate quality in the fact that they often work behind the scenes and out of the limelight, but at the same time, they're so essential in helping us to you know, put together important deliverables that you know, we have to do on a periodic basis to our regulators. So they've just been so essential in being there for us regarding that effort. In addition to their customary work in the areas of patient safety, risk, and infection control, they are also very instrumental in our overall performance improvement efforts. And lastly, regarding the quality team, they've been an essential element in our ongoing effort of maintaining survey readiness, particularly during the pandemic. They were just invaluable during this period for us, and not only during the pandemic, but recently during the completion of 2 of our important surveys. So quality team was just really essential in both those surveys for us. And with that, I will hand it off to Monica for a few updates.
Thank you, Michael. Good afternoon, Commissioners. I just wanted to take the opportunity to share the recipients for our Daisy Award recognition with you all. I think you all received the actual video part of that, so you were able to see that. And if you have not, I would encourage you to do that, to see how emotional yet rewarding this experience was for most. So the first individual is Angela Louie. She's a registered nurse on North 6, and she received many nominations, highlighting her dedication, compassion, her strong communication skills, and just overall support of the team. Next slide. PA who works on South 2. She also works in our Laguna Premier Club. And when we read the nominations for Kimberly, we all, I can speak for myself and most others, we all became very emotional because it was so heartwarming to hear residents talk so favorably about our staff here at Laguna Honda. One of our residents said, first and foremost, that Kimberlyn has taught them to love themselves. And so we were very excited to be able to highlight Kimberlyn's work that she has done here at Laguna Honda with our residents and the support that she has given them. Next slide, please. So for the team award, we recognize our South 5 team. South 5 was in many ways the epicenter for the pandemic at Laguna Honda. That is the unit where our COVID patients were sent. And so it was great to recognize this team, and as you can see, there's some of the members in the photo. They were elated, and shocked, because they did not think they were going to get this recognition. And so we had to tell them, come up to the stage, because they were so in shock that they had actually gotten the Daisy Award. And really, I need to recognize Maria Chavez-Lagasca, because she's the nurse manager for that team. She was the nurse manager for that team during this time. And it was her leadership which actually got the team through the pandemic. In support of her and Irene Blanco, the director, they supported that team to be successful in taking care of our COVID patients here at Laguna Honda. Next slide. So our award recipient for our leader went to Marvin McGregor. Marvin is fairly new to Laguna Honda. He's been here a little bit over a year, and he received nominations talking about his ability to celebrate, appreciate, and lead staff and be visible. Most of the residents, even those not on his unit, know who Marvin is. Most of the staff know who Marvin is, and as he walks down the hall, they greet him. He comes in early to make sure he is able to round on all of his shifts. He's just an overall great leader and a representation of the leadership that we have here at Laguna Honda. So congratulations to Marvin. Next slide, please. The executive team and I want to take the opportunity to recognize our nursing director, Jackie Spencer-Davies, who retired last week from Laguna Honda. So, yay to Jackie. She served her time as a nurse and a social worker at Laguna Honda and other facilities and decided that she wanted to retire. So as you can see, this is a picture of Jackie. I think she said she was 19 years old. And then this is a more recent picture of Jackie doing what she loves. And so we're very happy that Jackie is being able to retire and spend time with her family. But most importantly, Jackie helped shepherd Laguna Honda through the turbulent times as she stepped up as the interim chief nursing officer 2 years ago and led Laguna Honda through the most challenging part of the pandemic. So I wanted to share that with you, commissioners, and let you know that Jackie has retired. And we just want to thank Jackie for what she's done for all of us, including me during my time here. Jackie supported me tremendously. She helped make my transition easier. So congratulations to Jackie on her retirement. I'll turn it back over to you now, Michael.
Thank you, Mike. Thank you. Okay, so just a couple more slides. Just a quick equity update. So our Equity and Culture Initiative is progressing very well under the leadership of Ami Fishman, who is the department director. Ami is engaged in solidifying the council and building its foundation. The initial work of the council has been focused on streamlining communications, training and education, and creating mechanisms for improving staff engagement. And Ami will be giving a detailed update to the commission during next month, so you will get a good idea of some of the more detailed work that is taking place in the department. Next slide. We're very pleased to have 9 representatives from Laguna Honda who are participating in the DPH Anti-Racism and Equity Inclusion in Equity Inclusive Leaders Fellowship Program. This is a 5-month program that will require a time commitment of 4 hours per week for the first 2 months, and then an additional 3 hours every other week from August to October. So as you can see, it's a very significant time commitment, but we will, as an organization, benefit significantly from having this number of individuals go through this program. And hopefully going forward, we will continue to have a fair representation as well. This fellowship is being led by the DPH Director of Workforce Strategies and Programs, and his name is Dante King. And the program is designed to support leaders who have an interest in this area and a desire to learn how to facilitate creating anti-racism operational change. So, next slide. And then finally, the month of May was Asian American Pacific and Pacific Islander Heritage Month. And so this was another important celebration for us here at Laguna Honda. And particularly, it was important for us because nearly 2/3 of our staff identify as AAPI. So in addition to offering special menu selections in our cafeteria, we also implemented our traditional poster display that we do throughout the hallways. And this is really a great opportunity to highlight contributions of various AAPI leaders in a variety of fields. Because it's so important for us to be respectful and inclusive of all the cultures here at Laguna Honda, we continuously look for new ways in which to recognize some of these particular efforts and cultures. We will continue to utilize the poster display because it's just such a fine way to recognize a large number of individuals, but also it's an easy opportunity for staff to take some time to read the posters and maybe spark questions. And so we will continue utilizing this format as we go forward. And with that, I will pause and see if we can answer any of your questions.
Okay, thank you very much, Michael. And before I ask if any of the commissioners have any comments or questions, let's see if there's any public comment. None. Okay. Commissioners, do you have any comments or questions on the report?
There we are.
Sorry.
Yeah, I even put my hand up. How's that?
Yeah, I know.
It's
Okay, now I'm okay. Now I've got mine, my screen appropriately divided so I can see the participant hands. Okay, Dr. Chow.
yes. Well, I wanted to thank Michael and Mr. Phillips for the executive team report, which I think has matured over these several months. And I think it does also show that we are getting a better grasp on how Laguna Honda is actually working on these topics that we say are the cornerstones of the pyramid, or the foundations rather of the pyramids. So I wanted to thank him for that, because I thought the summary was really easy to read this time and was very helpful. what I would, I also noted that with Dr. Howard coming on board, just wanted to make a note that he comes out of the program that a former health commissioner of ours actually, brought to prominence, which was Dean Karshner, who served on the commission for a number of years and really brought her leadership to us. It was a important experience for many of us who was able to work with Dean Karshner. And here now we're bringing a product of her pride of also making the director of whatever the DNP, the degree and the number of degrees that she actually brought at USF, which will help enhance our health workforce here. I think lastly, I just wanted to add if in the report that we're expecting in July in equity and culture, if it could actually also address two issues that have been on a long-term or basis here at Laguna. One is how we're addressing culture, and we know that we have several units that are dedicated in that manner, but it would be interesting to find out, however, throughout the entire organization, how we are working on cultural competency and how that and what she might assess at this point that we're at, and also then what her goal might be in terms of improving that. It goes to a topic that also had risen at the full commission, but I think it's one that's really very special here, where we have the diverse populations. And lastly, the other aspect I would like to see, because now that there's a department that actually is working on this, is to work on the issue of diversity within our population workforce. And whether that has to be actually a diverse workforce by exact quotas, or are we actually making the workforce competent and understanding of the various population it is caring for. What are the thoughts and plans for that? So I'm really looking forward to the July report and seeing how we are then going to, with the Department of Equity and Culture, be able to answer these in a much more focused way. So I want to thank Mr. Phillips for actually creating that. And I really then look forward to, as I said, the report coming in July.
Thank you.
Thank you, Dr. Chow. Dr. Green.
Well, Commissioner Chow made so many excellent points there, and I guess the only thing I would add is I was really impressed by the answers that you shared on the some of the questions I had raised. And what really struck me as I looked at those answers, some of which relate to the executive report, is that the detail tells me that this team is working together so well. I would never expect a CEO to know like details of all the aspects of the plans of care, but I know the only way that's possible is if you're really communicating well and working as a cohesive unit. So I just wanted to thank you for the answers you just gave, the answers that you gave in writing, and it's quite impressive. So that was the only addition I wanted to make.
Thank you for saying that, Commissioner Green, and I can assure you that our CEO does not know everything. We have a superb leadership team, and which is why, although it takes us some time to put together our answers to some of your questions, they are posed to the right individuals and who give the superb input. So it's a real team effort.
Thank you. Thank you very much. And as I say, please feel free to answer them on the fly during these meetings. I don't need them in writing. I just wanted people to have a chance to think things through before our meetings. I'm more than happy, and I think other commissioners would probably agree that if these are covered in some of the presentations, that's just fine, because then it's part of the general record as well, and others can hear the details.
Great. Great. And I actually wanted to thank you for the detailed answer to the last question. I think that Dr. Green had asked about what it takes to bring somebody on and that process. And I know that it's something that we throughout the network and actually throughout the department have a lot of concern about, or have had a lot of concern about, particularly given just the challenges of trying to recruit people to San Francisco, qualified folks having to share uh, uh, the talent across the whole department and not being able to do your specific recruiting or having to compete for all of that talent. So the challenges are great, but it does help to know what are all the sequence of events that need to happen in order to get the very talented individuals that we have seen come to Laguna Honda. And in that vein, wanted to congratulate you for being able to recruit Dr. Howard on that. I think was just something that we really, I think is important and needed for Laguna Honda. And also, I think having done that, uh, really sort of, I think, puts us in a good position to recruit beyond that, to know that we're able to sort of to bring on such talented and experienced folks. So congratulations. And then also wanted to thank you for sending to Mark and having Mark distribute to us that video on the Daisy Awards, because again, not being able to be there in person, but being able to see, at least from video, the kinds of celebratory activities that happen that bring folks together and create the culture, I think that we are familiar with that exists at Laguna Honda is something I think is very, very, it's very nice for us to be able to view until we get a chance to be there physically and get the sense of that again ourselves, hopefully soon in the coming months or so. And then again, also glad to hear that the posters that you put up for Asian American Pacific Islander Heritage Month are going to be sort of, at least for the time being, a permanent fixture. It would have been nice to have had a chance to see all of that up in visiting the facility, and glad to know that that might be possible as we visit in the future. So again, another great report, and thanks very much. Looking forward to continuing good work. So Mark, why don't we go ahead to the next item?
Regulatory affairs report is the next item.
Okay, Naz?
Yes, good evening, commissioners. Hope you're all doing well and hope we get to see you in person soon. I wanted to share with you the regulatory affairs report, which reflects the activity for the month of May. Laguna Honda submitted a total of 20 facility reported incidences with 4 anonymous complaints that were shared to the facility by CDPH. You have the breakdown there in front of you. The month of May, we hosted 2 unannounced site visits. As you can see, CDPH is kind of catching up on all their facility reported incidences from Laguna Honda. Additionally, we submitted 3 plans of correction, 2 of which were related to our annual surveys, and 1 to an incident which was back in 2019. Are there any questions or comments on the report that you have?
Any questions from the commissioners?
I'm just only wondering, with the number of facility reports that seem to be declining, do we think this is sort of the base that we've encouraged people to be reporting these, and that the numbers are, appearing quite low compared to 2019 and even the early part of 2020. So that's good, providing that people are now really able to report, and we don't have that many to report at this point. So I just wondered what your feeling was on the lower numbers.
Yes, I mean, I think it ebbs and flows as the months go by, as we've seen over the months that we share with you. You know, part of that, the hypothesis has been that it's due to the pandemic, that most of our residents are here. You know, we've seen increases in some dips in res-to-res allegations of abuse due to their, you know, being here on the premises. It will be interesting to see how the number of incidences changes as we open up and residents are more able to go out in the community and so forth. I think part of that work as well is a great partnership that's building between quality and nursing as well as with medicine. I think, you know, the three of us come together weekly to talk about process improvements and opportunities and really try to do just-in-time improvements. And another part of that as well, I think, as part of Michael's leadership, is asking the executive leadership to do constant rounding on the unit. So I think that there's a lot of improvements that have happened over the months, and my hope is that that's seen in the numbers, but we'll just need to continue to learn and monitor.
Good, thank you.
And I'm sure we'll hear more about that, the rounding and coming together between nursing quality and medicine in the upcoming presentation. That I think is the next item on the agenda, unless there are additional questions for Naz. No? Okay.
Thank you.
Thank you. Okay.
So item 6 is the presentation on Laguna Honda Hospital Nursing Department.
Okay.
Good afternoon, Commissioners again. This is Monica Biley, the Chief Nursing Officer here at Laguna Honda Hospital.
And Edward Guina, the Director of Nursing Operations here at Laguna Honda Hospital.
So we are very pleased this afternoon to present a nursing update to you. So I'm going to go ahead and start, and then I'll call Ed back up when he is going to present his part of the presentation. So you move the part up there. So this first slide really, you know, a lot of times when nurse leaders enter these type of positions, we're asked, what is your nursing vision? And my answer always is, it's not my vision. The nursing vision should be a collaborative effort between leadership and frontline nursing. So what you see here is my vision and the components of what the nursing vision will have. But the goal, Commissioners, is to really work with our frontline staff and create a vision for nursing here at Laguna Honda. So what you see is that, you know, I'll tell you, I've been a nurse for 21 years, and 19 of those years I've been in leadership. So I'm a little bit old school in my thinking, and you'll see that throughout this presentation. I come from the school of Maxwell and Blanchard, where I believe that leadership and serving is the key to our success. And so that will be an underlying theme throughout this presentation. So the patient or the resident should be at the center of everything that we do. Our core values should be a key component to our nursing vision, and those core values include integrity, honesty, teamwork, care, and kindness. Not to mention, we should be True North focused. So DPH has our True North goals, which you can see there. And I want you to make note of what this picture looks like, because we'll come back to it at the end of the presentation. In addition to that, clinical competency. You know, it's our responsibility as nurse leaders, myself and my team, to ensure that our nurses are clinically competent. And we have some work to do in that area. Really looking at the American Nurses Association scope of practice and also the code of ethics. Nursing excellence should be what our priority is, and we should all be aiming for that. So as registered nurses, we have a responsibility to self-develop and improve our professional practice. And I'll talk a little bit more about that as we go through the presentation, as well as shared governance, which means that frontline nurses need to make decisions about nursing practice and policy. It should not be a top-down approach. It should actually be a bottom-up approach. And they should be able to be innovative and make changes. So having unit-based counsel on the unit and having clinical practice committees within Laguna Honda is a goal for us, as well as innovating, and ultimately, our goal is to be the leader in post-acute care. I apologize, my clicker here is not working. So what can you do? So I know this is hard to see, and thank you, Commissioner Green, for asking for a larger document so you all could read it. I put arrows in here because I wanted to point out a few things. But first I'll say that organizational success is driven by strong leadership. So whenever I go into a position, I always assess leadership and make sure that there's enough support to provide frontline staff the leadership visibility that they need. There are almost 1,000 nursing staff here at Laguna Honda. And what I did notice, and you referred to it earlier about Dr. Howard, is we have some very educationally accomplished leaders here at Laguna Honda. I've had the opportunity to work at the 2 biggest healthcare organizations in the country, and I will say that we have some of the most educated leaders here, from the supervisor level to the manager level to the director level, which is a very positive thing. So when I first came into my role, I met with the nursing directors and we talked about what their professional goals were. We talked about their challenges and where they saw Laguna Honda in the future and how they wanted to contribute to that. With that being said, we decided to do some reorganization here at Laguna Honda. We restructured the director responsibility so they can have more focused and an equitable workload. We also made some changes that I would like to point out, and this is what my arrows depict. So one of the first things that we did here, and I have to thank Michael Phillips because he was very supportive of it. He didn't ask a lot of questions because he understood how important this was, but that was to get a director position for the Department of Education and Training. That department is responsible for training all 1,700 staff here at Laguna Honda, and it's a very small but mighty department, but they did not have director leadership. The other area that I want to point out is under nursing quality. Naz mentioned how we have transitioned and we are developing a very strong collaborative relationship. So one of our nurse leaders said that that was her focus and her interest, and so we transitioned nursing quality from being a committee facilitation to more of someone who is going to partner with quality along with myself to lead nursing quality. So that responsibility went to Susan Young, and she's doing a fantastic job at that. In addition to that, the other arrows, which I've mentioned previously, we have nurse managers who are working on the AM shifts. This is new to Laguna Honda. The reason for that is because we need visibility and support for our AM shift. So when things happen at night and the executive team is not here, we have a manager actually here to provide that support along with our nursing operation or house soup. In addition to that, most recently, and I have to acknowledge our finance team, they have been really supportive of me and nursing and have come up with creative ways to budget for these positions. So went to them about a month ago and said, because that new nursing manager position on the AM shift is doing so well, we're already seeing a return on investment in many areas. I really need another one. They laughed just like everyone here just did. And they said that's not how it works. And you know, I have to remind you that I've spent most of my career in the private sector, so I'm used to going and asking for positions, and that's how it works. But they came up with something creative, and I'm pleased to say that we're gonna have 2 part-time nurse managers on the AM shift. Those positions have already been approved, and they are gonna get posted here shortly. The other thing that I wanna point out is our behavioral response team, and I'm gonna go into more detail about that as we get further into the presentation. What I'll say is I appreciate Commissioner Green's question about how our management positions fill. that was a learning for me. But I will say, and I think Ed would say as well, is that over the course of the last 6 months, our positions have been filled more quickly than any other time here at Laguna Honda. So we're very happy for that partnership with finance and others to get these positions filled. Next slide. One of the biggest focus areas for me as the Chief Nursing Officer is nursing leadership development. So we have 3 areas of leadership here, formal leadership. I believe all staff are leaders in their own right, but former leadership related to titles. And that's our directors, who are our nursing supervisors, our managers, and our charge nurses. So we started here encouraging our nurse leaders to attend AONL courses and take leadership development classes outside of DPH, because that is really what the standard is, and many of them have done so. One of the things that we're working on is the idea of leadership versus management. As you see, and you all know, leadership is really about influencing others, empowering them to do their best work. Management is getting things done through people. And in successful organizations, leadership is what reigns true as far as the success that is accomplished. And then culture development. We are seeing a transition here at Laguna Honda. I think over the course of even prior to my coming, there's a lot of work that has been done with transitioning the culture, but we need to continue with that work. So the next area is managers. I have met one-on-one with all the managers, and I talked to them about their goals, aspirations, areas that they want to focus on. And after doing that, it was clear to myself and the directors, after we had a discussion, that we need to have a formalized manager development program here at Laguna Honda. And one of the development programs that is widely used in the private sector are the competencies from AONL. And so those competencies, we're hoping to integrate and start having development sessions with our managers in winter of 2021. The focus is the science, which is managing your business. The art is leading people, and then the leader within is creating the leader within yourself. And then lastly, and I think the most important group of people that we really need to focus development on is our charge nurses. And I believe that was identified a few years ago, that we needed to have a focused development program for our charge nurses. And so myself and the directors have been talking a lot about that and what that's going to look like, and hoping to start that in spring 2022. Next slide, please. So we spent a lot of time talking about quality, and I would like to say that our team, our nursing team and our quality team, there are a lot of new people in these roles, and we're learning and transitioning, but working very collaboratively, because I think, really all of our focus is the resident and the patients here at Laguna Honda. And so when you have that focus, people are more willing to work together. So from a nursing perspective, we need to really transition and redefine quality and move from a reactive to a proactive approach, focusing on the quality of care to our residents and patients, and reducing harm and eliminating harm. We need to focus on clinical excellence. There are approximately 30 measures, not just quality measures, that's including the staffing questions that we also get asked, which Ed will cover during his presentation, that focus on quality. And we need to use data to improve, or that data to improve our outcomes through a balanced scorecard approach, which we've had a lot of conversation with our quality colleagues about this, and I believe we're going to work towards that. We need to be resident and patient-centered. We need to educate our care team staff as to what all of this means, because there are some knowledge gaps there. And then we are in the process of enhancing the advanced practice nurse program, and that is our clinical nurse specialist. There have been some changes to how they have been operationalized, and so they're more visible on the unit. They've had assignment changes where they actually are assigned to a unit, and they're working together more collaboratively to educate and support our care team. Integration of lean methodology and tools. I know that lean is a network focus, and that's what we use as far as our performance improvement program is concerned. We have some A3s that we need to further develop. We need to do some small tested change using PDSAs. But one of the most important things that I think we can bring back and have consistent processes and standardization around is daily engagement systems. I have seen how these have worked, and I know that Laguna Honda had implemented this a couple of years ago. And so we need to, things change, so I just want to call that out. With COVID, focus has changed. We transitioned into mitigating the pandemic, but now it's time to get back to the standardization of the work we were doing before. Accountability is also important. So medicine and nursing are responsible for resident patient care. And I think from a nursing perspective, that is something that we need to continue to reiterate and educate our staff on. We have a Nursing Quality Improvement Council that has been refined and redesigned. And we have a newly starting Nursing Quality Oversight Steering Committee, which is made up of leaders and also frontline staff, which I think is key. And then we need to look at improving our processes in MDS to make sure that our data collection is accurate and to make sure that they are actually engaged in what's going on the resident care team and the unit. Next slide, please. So there's been a lot of successes with quality, and it's been because of the collaboration throughout the facility, not necessarily with nursing, but with nursing, with medicine, with pharmacy. I could go on and on. But our successes are, and I do feel that we are developing a collaborative relationship with quality management. And I think that that may have been a gap before, but it's most certainly something that has improved greatly, I would say, over the course of the last year. COVID mitigation, commissioners, you've heard a lot about COVID mitigation at Laguna Honda. I don't need to talk about how great, but that is one of the reasons I was attracted to this role, is because I heard about how well Laguna Honda was doing in the pandemic. Not to mention, you know, 88% of our nursing staff have received their vaccines, which is fantastic. And as you look and read articles about what's going on nationally and also statewide, that's probably the highest number there is out there. We had the successful relicensing and life safety surveys, and of course, that was a collaborative effort with facilities and quality and pharmacy and all of the other disciplines. And then I think it's really important to call this out. I had mentioned this yesterday, but every day I see the power of this collaboration. We have a strong collaboratory relationship with pharmacy. So when you talk about safety, that is key. And our pharmacy team, led by Dr. Fouts, has really partnered with nursing to be proactive around medication safety. And that has been the key to our performance in barcode medication administration, which we did a presentation for you all a couple months ago. But I just wanted to highlight that because I think it is something that has been a breath of fresh air for me here in my role. So opportunities for us, obviously, to decrease facility-reported incidences, decrease 2567s. You know, all healthcare organizations get 2567s, but Laguna Honda, I would say, exceeds an amount of 20, to be transparent, that in my experience. And I think, you know, we all agree to that, and we'll continue to work on decreasing those. We need to meet our performance improvement goals, continuous survey readiness. And then this is another important highlight that me and my team have discussed. We need to have frontline-led quality initiatives. What that means is having frontline nurses lead some of our quality initiatives and take ownership of them. When that starts to happen, which it will, then we'll know that we have made significant progress in our quality program. And then, of course, full implementation of our QAPI plan. Next slide, please. So safety, the culture of safety. I remember being in my interview, I don't know how long, 7 months ago, about 7 months ago, and there was a lot of talk about the culture of safety and asking me questions around that. And I was impressed with the fact that that was a priority here. So Joint Commission says safety culture is the sum of what an organization is and does in pursuit of safety. It's our behaviors, how we act, how we lead, and how we show up. So, you know, when I look at safety, I believe that Laguna Honda has come very far in integrating and changing in our new quality team, and I believe that Troy also had these tenets of safety culture and his strategy for quality. It's key that we integrate this into our day-to-day functioning, and I'm not going to go through these. I think you've seen these, and all of us have seen them as well. But really, it's about increased leadership visibility, and Naz alluded to, you know, Michael and giving him the credit to really say that our executive team needs to be more visible on the unit. And instead of having leaders from various departments be the executive team sponsors, the executives are now the executive team sponsors, and I think that's been happening for about 4 or 5 months now. And then the nurse managers on the AM shift, I can't say how important I think this is going to be. And when we get the other 2 managers who are going to be part-time but make a full-time person, I think we're going to have visibility on AM shift that's needed. So staff can report issues that come up, so people can feel safe. So managers are rounding at night, making sure that our residents have their needs met. In addition to that, approachable leadership, I would say that I, on a regular basis, have meetings with frontline staff. I know Michael gets a lot of calls from frontline staff as well, and they want to talk about how that we can improve here at Laguna Honda. Rounding for outcomes, timely reporting of incidents, resident interviews, implementation of our BRT, which I'll go into a little later, and then just culture. You know, just culture recognizes that errors occur due to human error and the systems that we work with, but we need to determine why we have these errors and look at what led to certain events from a non-punitive standpoint, but a learning standpoint. And some people say, well, just culture takes away accountability. It doesn't take away accountability. It creates an environment where people want to report because they know that there's not any retaliation or it's not punitive. But at the same time, with just culture, there's zero tolerance for reckless behavior. So we need to create an atmosphere so when risks happen, staff come and report those risks. Next slide. So I wanted to share this slide. This is actually Naz's slide, but I wanted to take the opportunity because I think it's worth looking at. It tells a story, and so if you look at the top half of the slide, it says incidents with timely reporting of all allegations of abuse of CDPH. And prior to, I think about 3 months ago, there was only the percentages. And so recommendation was made that you have the number and also the number of misreporting. So when you look at that, you can see that except for a couple of outliers, you know, we usually miss 2 or 3. That 3 seems to be the average. And what I like about looking at this is that we actually know what those reporting misses are. We talk about them, we do root cause analysis as to why they weren't reported, and we need to make sure that everybody is appropriately reporting. Nursing is doing a good job, and we found that a lot of these mishaps aren't nursing, but it has to do with other departments that just need to be educated on how to properly report. This slide below, and Commissioner Green asked for a more clear slide with percentages, which we sent, so hopefully you are all able to see that as well. But what this shows is since December 2019, at least 95% of the residents received a check-in for the resident check-in. So if you look at the graph, we're checking in with our residents, and we've been meeting this goal since December 2019. I think that at some point, we need to look and say whether or not these things are hardwired, whether or not we can approach them differently and stop the actual reporting, but it doesn't mean that we're gonna stop doing. So I have acute care background. That is my background, acute care and ambulatory care. And I would recommend, and I've talked to my team about this, is that when we transition some of this reporting, actually before, because we need to really hardwire practice, is that we need to adopt some acute care practices. They kind of looked at me like, this is not an acute care facility, and I always say, well, it's not an acute care facility. We're licensed as a general acute care facility. You know, we have the largest DP SNF, but at the same time, the care should be at the same level. The experience for our residents may be different because we have different reasons for being in acute care and for being in long-term care. But acute care practice that most healthcare organizations have implemented because it's evidence-based is hourly rounding, unit leader rounding, bedside shift report, and those are the things that you should hardwire, and we will start doing that to assure that resident check-ins are being done and that staff check-ins are being done, because all of our teams should be hourly rounding on residents. So care experience, Michael covered the resuming normal operations in his executive report, but I'll say our residents are very excited about the fact that they're getting to visit with their families after over a year, they're getting to go out on paths, and that we're getting back to doing some of the activities that we had before COVID, such as Art with Elders, the Laguna Premier Club. So we're excited about those things. And then, you know, really for nursing leadership to engage with the residents. So I have check-ins with the residents, and I also mitigate their concerns, probably a little too much, as I get emails from residents asking me about things that is not necessarily in my purview, which John can attest to. I just send them to him, and he figures it out. But I think the good part about it is that they know who I am, and they're emailing me with their concerns. And then nurse director rounding. Nurse director rounding, I would say, was inconsistent, but now it is consistent. So the nurse directors are out there visible, and they're rounding more. Still an opportunity for me and the nurse directors. It's very easy to get sucked into all the other work that we do, but we have to consistently make this a priority. So the behavioral response team, I've talked a lot about it, and I'll share that this process started prior to COVID, and it's my understanding that because of the pandemic, things got put on the back burner. The BRT was, I believe, a vision of the previous interim CNO, who had sent our the interim CEO, who had sent our interim CNO to get more information about this from Zuckerberg. And so, make a long story short, Jackie Spencer Davies, who we saw earlier, who retired, made this a priority to complete before she retired. So what our BRT is really teaching and supporting our care teams when they're confronted with residents or patients exhibiting escalating or challenging behaviors. The program goals are to develop and empower our care teams to acquire the skills necessary to work effectively with challenging residents, to increase resident satisfaction by increasing care teams' approaches to listening, reduce aggressive behavior towards staff and resident abuse, link with our Laguna Premier Club, which has restarted. So we started a pilot a couple weeks ago, on South 4. So far, the pilot is going really well. The South 4 teams feel like they're being supported differently. This is, there's much excitement about this, so I'm getting a lot of emails, when are we going to transition and bring it to all neighborhoods? I had somebody tell me today this has been long overdue and they want it rolled out ASAP. So the challenges with that is that currently the individuals who are actually the BRT team are a couple of nurse managers who have volunteered to do it in addition to all of the other work that they're doing, are one of our CNS and one of our nurses from DEP. Our hopes is that we are going to get funded positions for the BRT program, because we know it's going to have a great impact on the support of our residents and our care teams. And so we're looking forward to hearings, because it's our understanding that these positions are going to get approved so we can have people actually doing this work and be able to integrate it into Laguna Honda as a whole. So once the pilot is done, we'll do process improvement and look at some of the areas which we need to improve, and then move forward with moving it throughout the hospital. But again, this is something that we feel will have a great impact on our residents and our staff. So the next slide, workforce, and some of these things are already discussed. But really, when it comes to our workforce, the goal is to increase our employee engagement and satisfaction. And the shared governance model is one way to do that, which I talked about earlier. Staff recognition, which over the course of the last 2 months, I think you have seen in the executive report that we are recognizing staff more formally and more often. Creating a culture of collaboration across units is an area of focus for us, and also across departments. Developing a partnering relationship with labor. If there is one thing, well, I won't say one thing, one of the things. If there is one of the things that I can say that's been one of my successes as a leader, is that developing partnership with labor. If you have the right partnership and relationship with labor, you can accomplish a lot of things, and I think that we're moving in that direction. Our meetings with labor, I heard, are a lot less hostile and more partnering, which is great, because I think that they understand that, our focus isn't to come to a table and disagree, it's to come to the table and make decisions about how to serve our patients and residents. And then educational engagements focused on equity. I think, Michael alluded to this earlier, that we have a fellowship, an equity fellowship within our system, within DPH, and several nursing leaders are actually attending that fellowship so they can support the equity strategy here at Laguna Honda, and I hope to attend it in the future as well. So now I'm going to call up Ed.
Thank you.
Thanks, Ed. So feel free to comment. Feel free to comment on anything, and then go ahead and talk about nursing staff.
Good afternoon, commissioners. Yeah, and I'm actually very proud to announce that one of our successes this year and also for the past years, we're able to achieve a CMS 5-star rating in staffing. And we achieved this by consistently attaining hours per patient day, HPPD ratio, that is significantly higher than the state and national average. In fact, 21% higher, than California, which, one of the states that has the highest staffing ratio is here in California, and we exceeded that by 21% higher, and then 35% overall higher than the national average. This really shows our commitment, to optimum staffing, to provide a safe delivery of care for our staffing. One thing that is not, present in the slide is every regulatory survey, surveyors come and assess our staffing by looking and evaluating our staffing. And for this year, as well as last year, we didn't have any citations or deficiencies for regards to our staffing. And that alone is a good measure of success with regards to our staffing and workforce development. Our work doesn't stop from here. I know Monica and I have been already planning in terms of resuming what we call our staffing summit, where we assess our staffing every time, every year. Actually, I know with COVID, we sort of put that on hold, but we are resuming our meeting with our nursing leadership, our managers and directors to assess just in time our staffing needs as we move forward, with our goal of really providing the safest delivery of care for our residents. And I will turn it over to Monica in terms of the next slide.
Sure.
Thank you.
So our workforce, I've spent, I think, quite a bit alluding to DT because this is very near and dear to my heart. I really believe that this is our key to clinical competency. It's the key to a lot of the challenges that we have here at Laguna Honda, or have had here at Laguna Honda. DT is an under-resourced department for the responsibilities that they have. They have 4.5 RNs and 2 LVNs that are responsible for the education and training of 1,700 staff here at Laguna Honda. This includes and is not limited to, so I won't go through the 4-page document that outlines everything that DET is responsible for, but just to give you some context. They're responsible for education and training hospital-wide. They're responsible for e-learning modules for all staff, including physicians, and there's hundreds of them. They're responsible for in-services, hospital-wide orientation, nursing orientation, clinical education, and record keeping, to name a few. So education is really the key to clinical excellence. We've developed goals for DET, and really we want to have them out on the unit, doing elbow to elbow, at the elbow training with our nursing staff. And that's something that, with COVID wasn't possible, but it most certainly is possible now. And so really, we just want you to know, commissioners, that this is an area that there's opportunity to support. One of the things that I mentioned earlier was we were able to get a DET director in place. We got the business case approved in February 2021, and the position was filled last week. So that was a win for us, and we have someone coming into the role who not only meets the minimum qualifications, they also met our qualifications that we desired, and the person is also a doctorate of nursing practice. Department analysis and A3 development is going to happen with DET. There was an A3 that was created, I think, about 4 years ago that we need to relook at and update. We're going to be doing some restructuring of department roles and responsibilities, and we're going to resubmit a business plan for the next fiscal year because the business plan that was submitted this fiscal year was not approved. Ed, do you want to talk about our new grad program?
Yeah. Actually, this is what I'm really excited about, is to inform the commissioners as well as our exec team about our new grad RN training program. This is the first of its kind in Laguna Honda. I know we've had a probably informal training program in the past, but this is in collaboration of many, actually I would say a couple of years of work of collaboration with our Department of Education and Training, as well as our human resources colleagues in terms of launching this new grad program. The new grad program is a bit different from our regular onboarding as we focus and really tailor-made the orientation training program for new grad. This is about a 3-month program wherein we hire, train, and onboard new grads So our first cohort is actually starting in September of 2021. We have 4 RNs that we are trying to recruit and filter through our application process and onboard them by September. And our second cohort is scheduled around January of next year, another 4 new grad RNs that we're trying to onboard. So all in all, 8 new grads that we're, again, trying to onboard as part of our Laguna Honda staff. And I think one of the commissioners has a question about what's the goal of this program and why we're doing it now. A couple of years ago, when we are sitting down with our union partners, SEIU union colleagues, as well as our HR partners, there is an overwhelming feedback from our staff members about having some kind of a new grad program here in Laguna Honda. We've seen this in San Francisco General, wherein they have different programs for acute care in different specialties like ICU, med-surg, OR, but we don't really have such a program here in Laguna Honda. And I think for career advancement, we actually agreed and share the same sentiment that this is a great program to start with in Laguna Honda, having a formal new grad program. So this then originates from that discussion. Obviously, with COVID, we put that on hold until we resume discussions again with our HR partners and our DET. So here we are launching our first ever new grad program for RN, specifically here for Laguna Honda. Secondly, one of the goals of this is really promote long-term care in terms of, career choice for new grads. I think, skilled nursing facility is not as sexy, for lack of a better term, in terms of acute care. Working in acute care sometimes has its perks, but we want to kind of break that notion that you can actually have a great career in skilled nursing facility and long-term care. So those are really the reasons why we launched this new grad program, and we're looking at having this as a regular part of our orientation and hiring, and hopefully this is the first of many new grad programs down the road. Monica?
You want to talk about
Sure.
this?
Yeah. One of our true north, as well as our financial stewardship, and without a doubt, COVID really brought us a lot of challenges in terms of our staffing last year. Our staff are stressed in terms of just having the support, but we're able to find some successes, actually, even during the hardship of having the pandemic flood a lot of our fiscal year from last year. One of the goals that we set, I would say a couple of months even before COVID starts, is our centralized staffing. So centralized staffing was born out of the staffing summit that we had with the nurse managers and nursing directors. We're in nursing operations now funnel our staffing procedures to our nursing operations, meaning taking that responsibility out from the nurse managers and having a standardized way of doing our staffing hospital-wide. This also minimizes variabilities in practice in terms of staffing, and also provides a lot of time and effort back to the nurse managers to deal with really the important patient care issues, in the unit. This takes a lot of their time in terms of doing the staffing hospital-wide, and so far, even with a year and a half of doing our centralized staffing, we've actually seen a lot of good results. We minimize a lot of inconsistencies with our staffing practices, such as granting time offs, for example, minimizing floating in between units, and promote consistency of staffing. So that's one of the successes we have in centralized staffing. And of course, with the pandemic last year, even though with a lot of challenges with staffing, we're able to appropriately allocate COVID budgets to our nursing. We still also have decrease the use of travelers and registry, and stay within the budget that's allocated for us through our COVID budget from last year during the pandemic. And obviously, we cannot achieve this without a collaborative relationship with finance. So Vicky and Lily have been excellent partners with nursing, and we're able to really focus on patient care and providing us the staffing resources that we need.
Thank you, Ed. And just, to look at some of, our opportunities, there's always opportunities to improve on anything and everything. And so some of our opportunities around finance are utilization management, process improvement. Care coordination department, we actually are in the process of forming a new department here. It's going to be the Department of Care Coordination. And then also our overtime utilization, there was an A3 in regards to overtime utilization that we need to relook at, update, and implement. And then I'm going to have Ed talk a little bit about decreasing coaches and staffing office process improvement.
So yeah, so one of our goals, in fact, is part of our A3 when we're looking at overtime bonuses for our nursing, is the decreasing our coaches. So prior to the pandemic, actually the start of early 2020, we have developed a coach meeting tool that we have put in pilot for one of the units. We were able to actually found that this is successful for one of our unit. In fact, North 1, George Elster is the nurse manager there. And we are now discussing with CNSS about resuming this coach meeting program again, especially, after, the hardships of what the pandemic brings to us, as well as the staffing office in terms of relooking at the staffer assignment, and also bringing back our overtime capitation as part of the city ordinance rule that we follow every year. The city ordinance, the city did lift that ordinance last year in terms of waiving that overtime, but now we are relooking at that again and also evaluating the use of our overtime moving forward, especially for fiscal year next year.
Thanks, Ed. So future resource needs. Investment in nursing resources needs here at Laguna Honda. I think I have communicated really the need for DT to have additional resources. Education and training, when education and training needs are identified, we need to have resources to support those needs. So we've had some education training needs that have been identified that we need to have outside vendors provide. And so having resources to actually support those training needs outside of what we can do here in Laguna Honda is important. And then also analytical support. It's really important for DET to have analytical support. It's also important for some of our other departments, such as care coordination and UM and MDS, to have some type of analytical support, because we as nursing, we need to be able to measure our success. We need to be able to say that all of these interventions that we made and show data that aligns with our success. And so just looking in those areas and then determining what type of support we need will continue. So there may be requests coming forward for these things. And then lastly is something that I've talked to Michael about, and it's just something that I would ask the commissioners and the leadership here at DPH to think about, and that's to have a network chief nursing officer. In the organizations that I have had the privilege to work for, there was a network chief nursing officer really in charge of advancing nursing practice and changing the healthcare delivery system, and then really outlining what the strategic plan is for nursing. And I've had the opportunity to work with some extraordinary network chief nursing officers, and I've seen the impact of having that position in place and what it can do for an organization and for nursing. So as a CNO, I'm really passionate. I think most nurses are passionate, so let me just say that. But I'm really passionate about patient care and advocacy for nursing. And so I just want to make sure that you commissioners know that myself and my team, we are committed to clinical nursing excellence here at Laguna Honda. And we wanted to share with you a little bit today of what we're doing, our vision for nursing, and just opportunities that we have to improve upon the care that we deliver here at Laguna Honda. Thank you on behalf of Ed and I for giving us the opportunity to present to you this afternoon. Oh, I forgot my last slide. So this last slide, I think I asked you all to remember earlier the picture. So the picture earlier showed the same slide, but there was gaps between the actual symbol or shape. And so the goal is really for us to come together and bring all those pieces together so they fit like a puzzle with the patient and resident in the middle. And so the journey continues, you know, it's a marathon, and it takes 3 to 5 years to change a culture. And so we've embarked on that journey. But I also think it's important to recognize the emotional toll that the last year has taken on many of our staff, many of our leaders, and all of us as we went through the pandemic. And so as we develop a strategy to move forward, I think one of the main focuses for us as a leadership team, and also as we translate this to the bedside, is that our patient and resident need to be at the center of all we do here. So now I'm finished.
Okay. Thank you so much, Monica and Ed, for your comprehensive overview and presentation. It was admittedly a lot to digest, but it also indicates all of the fantastic work that your leadership has initiated, and how fortunate Laguna Honda is to have you at the helm of the nursing function there, or just nursing, and working so closely with all of the other departments. I'm really looking forward to seeing the fruits of all of that labor roll out over time. So let me go to the commissioners for quick questions. Dr. Green.
Well, I felt like applauding. I think what you've put together is absolutely brilliant. And to think that you've been able to do such intricate analysis in such a short period of time is incredibly remarkable. You know, I take care of a lot of nurses. I obviously work every day with nurses. And even today, I got an earful from a Kaiser nurse who works in the PACU and has had some pretty difficult experiences over the course of the pandemic. And you have basically addressed every dissatisfier I hear, and I think this is really important in part because, you know, I think there's really a frightening nursing shortage looming, because besides the programs that are now allowing people to fast track into the nurse practitioner role, so that bedside nursing, which is so physically and emotionally demanding, I worry about who this workforce will be. But as we all know, it's incredibly competitive. And I think in order to engage people, you have really thought about all the dissatisfiers that I typically hear. The nurses feel they have a lack of voice, and you've obviously set together a program where it's very clear what the structure is and how even, you know, a night shift floor nurse will have a voice. They feel that their own personal development and educational development is not held in value. It costs money for them to be trained. And you've voiced a very important commitment, because one thing I hear from a lot of the CPMC nurses is all these restrictions on their educational opportunities. And you know, you voiced significant support for expanding those opportunities rather than limiting them. And then I think, of course, access to leadership, which many people feel so disempowered. And, you know, leadership and management, it's so interesting you brought it up, because, you know, leadership and management can cut both ways. It can be top down, it can be disempowering, or it can be inclusive and empowering. And I think what you're describing is exactly what needs to happen. And when you say that people go into medicine because of passion for patient care, and that's absolutely true. And I think the pandemic, in some ways, because, you know, my understanding is once they liberalized all these things hospitals could do in terms of you know, staffing people, changing shifts, changing hours for people because of the pandemic, I think there have been a lot of people left feeling like they're widgets and really feeling demoralized. And I can't imagine that would ever happen with the leadership at Laguna. And I think it's particularly important because you are taking care of some of the most challenging patients. You do face the social determinants of health in ways that other hospitals don't. and yet you've been able to not only staff well, but maintain your staff and really exalt and celebrate them. So I will really look forward to hearing how this happens. I'd kind of be curious, Monica, to know how much of Kaiser, I know, has some, and I know you spent quite a bit of time there, has a lot of structures whereby some of these things are thought through, but then execution is a different issue, because I think there are a lot of ideas at Kaiser, but not necessarily those that come to fruition. And yet I think this is really realistic, and you set forth all of the plans that will allow this to happen. So I'd be curious to kind of get maybe a feel for what you feel can be accomplished. But as I say, I cannot say enough about how impressed I am by both this presentation, the way you've all worked together as a team, and about the potential for the future and stability of the staff at Laguna.
Thank you, Dr. Green.
Thank you, Dr. Green. Dr. Chow.
Yes, thank you. And Dr. Green sort of gave the accolades that I would second very heartily. Matter of fact, the presentation almost makes me want to become a nurse at Laguna. I mean, it was so dynamic, it was so great. And I think the vision that you are articulating, I mean, nursing is certainly the heart of the institution. Has always been, and reminds me of one of our old, one of our many year ago director who actually kept the institution going in those days back about 30 years ago, when often it was neglected as being somewhere out there, and a place where we were in a way warehousing the population. And she actually felt that everybody had to be treated as a person. So it is so nice to actually hear the visions that you have. And I'm also impressed that we can take the best, as you are talking about, from acute care and bring it into a SNF setting. I think if you're able to do that successfully, that this is another learning opportunity for the other SNFs that too often in long-term care are warehousing rather than caring for the residents. I would only hope in the rounding that you're not really going to do acute care rounding of waking up the patients every 2 hours and taking their blood pressure.
No, no.
I know you're not meaning to, and I think that's also tremendous intent. That I just kind of envisioned that in the past, when the daylight went away, so did really the presence of nursing, and it was like sort of a skeleton staff. I think the idea that this is a 24-hour job is also a vision you have. So I would look forward to some regular updates on your successes and some of the challenges. I think you've impressed the administration centrally, if you're able to get these slots that are really wonderful, and to bring a behavioral team here might in fact help, as you say, answer part of these staff to well, the altercations that we have either between patients or between staffs. So I think that is really also a very far-thinking attempt to try to answer the questions, what can we do best? So I really would look forward to the opportunity as you start implementing this, to understand how you are feeling that these initiatives, particularly that and the new grad, would also be panning out for you. And thank you for that very comprehensive org chart. I was able to actually read through, and now I understand all the different levels of nursing that we have. It is very complex, and I think it also does show the thought that has gone into the work that Laguna is doing, and you're taking up the mantle of continuing Laguna to be an excellent facility for our residents who need the care that they are here for. Thank you.
Thank you, Commissioner Chow.
Thank you, Dr. Chow. Well, you know, when you think about the history and the legacy of Laguna Honda, and how long this facility has been in place, one of the oldest in the country, one of the largest, to know that with the right kind of leadership and support, that it can continue to be a premier institution into the unknown future, but with the kinds of innovative, patient-centered, and values-based sort of strategic thinking and passion that you and the team have brought with the support of all of your colleagues. It's really something I think we have to think about. How do we make sure that that legacy of uh, and that history that Laguna Honda has established can really be promulgated and promoted, right, as a model, hopefully. You've raised the bar. You've also raised expectations. So we will be looking forward to very much hearing how things progress, and to know that this is, as you have said yourself, not just what's going on sort of singularly in the nursing department, but also because you're going to be able to do this because of the support and collaboration you have with your colleagues and with the executive leadership from the CEO and the support of both the JCC and the commission.
Thank you, Commissioner Guillermo.
Okay, great. Okay, so let's see. I think that was the last item on the agenda, Mark.
For the open session, yes,
Yeah, for
Commissioner.
the open session.
Yes.
So we can go into closed session if we have a motion to do so.
Move to go into closed session?
Second?
Call vote, Commissioner Guillermo,
Yes.
Commissioner Chow,
Yes.
and Commissioner Green.
Yes.
Right, if y'all could give me 30 seconds to switch us over.